3 things my patients didn't know what to expect when starting their GLP-1 medication journeys. If you're new to my channel, hi, I'm Dr. Jones, DC, a holistic obesity expert. Number 1, reductions in inflammation. This is so fantastic because now we have these medications that can help individuals like you watching this who are struggling with weight loss, maybe have massive issues with inflammation. For example, autoimmune diseases, PCOS, these inflammatory conditions derail your weight loss, exacerbate insulin resistance, and just give people another roadblock if they didn't already have enough already. So GLP-1s reduce inflammation. It's super awesome. Number 2, addiction issues. Not just alcohol, but smoking, gambling, even shopping, if you can imagine that. This is so wild. GLP-1 medications are probably going to be a treatment for various addiction issues because of the way they work in the brain. We know that there's GLP-1 receptors in the brain. We don't understand exactly how it works. I like to think of it as dampening the dopamine pathways in the brain that are all dysregulated for people with addiction issues. Nonetheless, we have a lot to learn, but it's super cool. And I always tell patients, if you do feel like you drink a lot and you're starting GLP-1s, take advantage of the fact that it's going to be easier to quit if you've been thinking about quitting in the back of your mind. And finally, number 3, rapid onset of weight loss after delay. This one seems to happen more to my diabetic patients because with diabetes, we have advanced stage insulin resistance. And so we're focusing on the flow protocol. We're focusing on getting them eating less carbohydrates, lots of fasting, lifting heavy weights. We're literally reversing their insulin resistance and the blood sugars are getting better. The fasting insulin levels are getting better. And the weight loss is kind of not so fast, typical to my other non-diabetic patients. And it seems like, boom, the light switches, all of a sudden weight loss is rolling. And I just don't know when it happens. It's always crazy, but I always tell them it's gonna happen and it kind of seems to work like that. So if you guys are curious about how we're putting this all together, if you're ready once and for all for lasting weight loss and you believe in the same narrative that we do, that diabetes and obesity are not chronic irreversible diseases and you wanna put in the work, shoot us a text message, guys. We'll keep it locked and loaded and stay warm out there.